2 weeks before her diagnosis. Her body already knew. Not her blood, not her heart, not a single scan or test in a hospital. Her nails knew first. A thin white line appeared across her thumbnail. She thought she'd banged it on a car door. She filed it down, painted over it, forgot about it completely. 14 days later, she was sitting in a doctor's office being told her kidneys were failing. That's not an exaggerated horror story for a thumbnail. That's basic, well-documented human physiology. And by the end of this video, you're going to look at your own hands completely differently because your fingernails are not just something you cut every 2 weeks and forget about. They're a living printout of what's happening inside your body right now. Your oxygen levels, your liver, your iron stores, even infections you don't know you're fighting. Today, every major nail sign your body can show you what each one actually means and the exact point where a nail change stops being cosmetic and starts being a warning worth listening to. Stay till the end because sign number 4 is the one emergency rooms are trained to spot first and almost nobody knows its name. This is even works. Your visible nail is dead keratin, but it sits directly on the nail bed, which is alive, full of blood vessels fed by the exact same bloodstream that reaches your heart, lungs, and liver. When something changes in your blood, oxygen drops, iron falls, and infection flares. That change gets stamped into the new nail cells being produced at the base. Since a fingernail takes about 3 to 6 months to grow from base to tip, what you see today is often a time-stamped record of something that happened weeks ago, sometimes before any other symptom appeared at all. Gen 1. White spots. Almost everyone has these small white flecks scattered across their nails. And almost everyone has heard the same myth that it means a calcium deficiency. Modern dermatology says that's almost entirely false. These spots are called leukonychia, and in the vast majority of cases, they come from minor trauma to the nail matrix. Banging a finger in a drawer, aggressive typing, a rough manicure. The injury disrupts how keratin cells pack together, trapping tiny air pockets that reflect light as white. The exception worth knowing: if white bands appear across almost every nail suddenly, paired and running parallel to the base, that's called Merck's lines, and they've been linked to low blood protein from liver or kidney conditions. Isolated flecks on 1 or 2 nails, nothing to worry about. Widespread white banding across most nails alongside fatigue or swelling, worth a conversation with a doctor. Gen 2. Redigious. Vervile vs heavile fine. Vertical lines running lengthwise are extremely common with age, the nail equivalent of fine lines on skin, and almost always harmless. Deep horizontal grooves are a completely different story. These are called Bowes lines, and they form when the nail matrix actually pauses production for a period, usually because of a major physical stress, a severe fever, major surgery, chemotherapy, uncontrolled diabetes, or serious nutritional deficiency. Because nails grow at a known rate, doctors can measure the distance from the cuticle to the line and calculate almost exactly how many weeks ago the illness happened. If you see one, ask yourself, did I have a serious fever or illness a few months back? Usually you can connect the dot immediately. If you can't and it keeps recurring, that's worth mentioning to a doctor. Sign 3. The blue-purple tinta, bluish or purplish nail bed is called cyanosis, and it's one of the fastest visual clues doctors use to judge blood oxygen levels without any equipment. Well, oxygenated blood is bright red. Poorly oxygenated blood is darker and bluer, and your nail beds are thin, vessel-rich windows into that color. Cold hands causing a temporary blue tint is completely normal and harmless. It disappears the moment you warm up. But a blue or purple tint that stays even when your hands are warm, especially alongside breathlessness, can point to a genuine oxygen problem, from lung disease to heart conditions, and is not something to wait out. A quick self-test doctors actually use. Press your nail until it turns white, then release. Color should return within about 2 seconds. A longer delay can signal poor circulation. Gen 4. Spoon nailsis is the shape change sign called koilontia. Instead of the normal gentle curve, the nail flattens and then curves inward, forming a dish deep enough that in advanced cases, you could balance a drop of water on it without spilling. This is one of the most strongly linked signs on this entire list, tied specifically to iron deficiency. Anemia, usually more advanced or long-standing deficiency, not a mild dip. It often shows up alongside fatigue, pale skin, dizziness, and unusual cravings for ice or chalk, a specific symptom called pica. The good news: iron deficiency is one of the most fixable conditions here. With proper blood work and treatment, the nail's shape gradually normalizes as healthier growth replaces the old nail, though it takes months, not days. Gen 5. Nailclip, this is the sign. Medical schools drill hardest into every student. The fingertip becomes bulbous, the nail curves more dramatically, and the angle between nail and cuticle flattens or even reverses. There's a simple test called the Shamroth window. Put 2 matching fingertips together, nail to nail. Normally you'll see a small diamond of light between them. In clubbing, that window disappears completely because the nails curve enough to meet flush. Clubbing has been associated with chronic lung disease, certain congenital heart conditions, and inflammatory bowel disease, believed to happen because abnormal blood blood flow lets specific growth factors reach the fingertip more than they should, driving tissue changes over months. It develops slowly, so compare your hands to old photos rather than checking daily. If you notice progressive change alongside a persistent cough or unexplained weight loss, that combination is worth a prompt doctor's visit. SIJN 6. Yellow nail most. Yellow nails are simply polished stains and fade once you stop using dark polish. But persistent yellowing, thickened, crumbly, sometimes with an odor, usually points to a fungal infection. Extremely common, especially with long-term gel manicures or damp environments. Rarer but more significant is yellow nail syndrome, a specific triad of thickened yellow nails, slowed growth, and chronic respiratory or lymphatic issues like recurring sinus infections or leg swelling. If your yellowing comes bundled with those symptoms, that's worth flagging to a doctor rather than treating with an over-the-counter cream. Sigen 7. Teething small, pinpoint dense, scattered across the nail surface are strongly associated with psoriasis. The same overactive immune process that causes skin plaques also disrupts the nail matrix. Interestingly, pitting can appear before any visible skin patches show up, making it an early clue in people who don't yet know they have the condition. It's also linked to alopecia areata. If you notice pitting alongside any scaly, itchy skin patches anywhere on your body, even the scalp or elbows, that's worth a dermatologist visit. Sigene 8. Dark streaks. The one knot to Nyogura, thin dark vertical line running from cuticle to tip is called longitudinal melanonychia. In many people, especially those with darker skin tones, this is simply a harmless cluster of pigment cells, common and often present for years unchanged. But doctors always rule out something rarer first. Subungual melanoma, a form of skin cancer in the nail matrix that's frequently mistaken for a stain or bruise until it's more advanced. Warning signs include a band wider than a few millimeters, blurred, irregular edges, a single nail rather than a symmetric pattern, pigment spreading onto the surrounding skin, and any visible change in size or color over time. There's a well-known case in dermatology education. A musician who noticed a dark spot under a toenail after a sports injury and assumed it was simply bruising from the impact. It was later found to be subungual melanoma, already advanced by the time it was properly diagnosed. His case is still cited today precisely because it shows the exact trap we've described throughout this video. A nail change being explained away by an obvious everyday cause when the real answer needed urgent attention. An ordinary bruise moves toward the tip and grows out over a few weeks as the nail grows, eventually disappearing when it's clipped away. A pigment streak behaves differently. It stays as a continuous line the entire time it's visible rather than migrating and fading like a bruise would. The single most important rule from this entire video: any new, changing, irregular dark line on one nail deserves a 5-minute conversation with a dermatologist. It costs almost nothing and can catch something extremely early. A few quick might yes worth killing white spots, meaning calcium deficiency. Already covered. It's trauma, not nutrition. Gelatin or collagen supplements dramatically strengthening nails. The evidence is mild at best and won't fix any of the systemic signs above. Nails needing to breathe without polish. Nails don't take in oxygen through the surface the way skin does. The real reason to go polish free occasionally is simply so you can actually see your natural nail bed. Biotin fixing any nail problem. It helps in true deficiency or certain brittle nail cases, but won't touch an iron deficiency, fungal infection, or psoriasis. And high doses can even throw off certain thyroid lab tests. This matters most for in kids and teens. Almost every nail sign is mechanical: biting, picking, a bad fever, rarely a hidden disease. In adults 20 to 45, the signs worth watching are the common, fixable ones: iron deficiency in menstruating women, fungal infections from gyms or long-term gel manicures, early psoriasis, pitting. Past 50, 3 signs deserve extra attention specifically: clubbing, genuinely spoon-shaped nails, and new dark streaks. Since this is the age range where lung disease, chronic iron deficiency, and melanoma risk all climb. A note on toenails: everything here focused on fingernails since they grow faster and give quicker feedback. But fungal infections are actually far more common on toenails first, thanks to warm, enclosed shoes for hours a day. If you're checking for fungal yellowing, your big toenail is often where it shows up years before a fingernail ever would. Bringing together your nails aren't a diagnosis on their own. They're an early notification system. Color changes usually reflect your blood and circulation. Texture changes reflect matrix disruption, often autoimmune. Shape changes reflect longer, sustained conditions like chronic iron deficiency or oxygen issues. The simplest checklist: how many nails are affected? Has this appeared suddenly or gradually? Is there a second sign alongside it? And does does it match how you actually feel? That's what turns a random observation into something useful. Take a genuine look at all 10 nails in good light sometime this week. Polish free and note what's normal for you. And remember, a nail sign is a prompt, not a diagnosis. It's a reason to start a conversation with a doctor, not a replacement for having one. You don't need a lab or an appointment to start noticing. You have a built-in early warning system at the end of every finger, quietly recording your health history. And most people have simply never been taught to read it. The next time you're waiting for coffee or stuck in traffic, take 10 seconds. Actually look at your hands, not to panic, just to notice. Because sometimes the earliest signal your body sends you isn't something you feel. It's something you were always meant to simply look down and see. If this taught you something new, subscribe. We're covering the rest of your body next, one hidden signal at a time.